Hello, everyone, and welcome to this week's Healthcare Current Event Update. My name is Mike McLafferty, and I'm the CEO and founder of MGM Advisory and Educational Services. This week, we want to focus on the Centers for Medicare and Medicaid Proposed Rule for inpatient prospective payment. There's approximately eight items that we want to go over with you. That hit the highlights for the proposed rule. First, we want to talk about pay rate. And the good news for hospitals here is there's a proposed 2.8% increase in the pay rate for fiscal year 22 compared to fiscal year 21. However, that rate does not include any potential reductions for readmissions, hospital acquired conditions, or value-based purchasing. Second, there's a repeal of price transparency requirements for hospitals where they do not have to report the median payer negotiated rates for Medicare Advantage plans. This is expected to save thousands of administrative hours for hospitals by not having to report this information. Number three, disproportionate share payments. The rule is proposing to distribute $7.6 billion in DISH payments. That is approximately $660 million less than 2021. And I think the hope here is that as the economy improves, people go back to work, the amount of dollars needed for the DISH payments will hopefully go down. Add-on payments for treating COVID-19 patients. Good news again for hospitals here. These add-on payments are going to continue throughout the public health emergency. They'll end in the fiscal year that the public health emergency ends. Again, good news for hospitals for all the additional costs that they incur for servicing patients who have COVID-19. Number five, value-based purchasing program. During the public health emergency, these programs are basically rescinded. They're no longer in effect as far as data being collected by CMS, which means that for fiscal year 22, all hospitals will receive neutral payments regarding this particular program. That certainly, again, takes away not only administrative issue, but all of the difficulty involved with dealing with the COVID-19 patients and trying to run the hospital systems efficiently. Number six, inpatient quality reporting. Here they are looking to add a couple of measures, one for maternal morbidity and the second one for various medication-related adverse events. They're looking to remove one measure, exclusive breast milk feeding. Number seven, graduate medical education. This is really a substantial investment that CMS is proposing here to add 1,000 medical residency slots that Medicare will fully fund. This will be prorated, 200 slots per year, starting in fiscal year 2023. There has been for years on the hospital side requests to CMS to fund more of these slots because of the going forward here, a reduction in the number of physicians available because of a lot of the baby boomer doctors in particular are retiring at this point. And number eight, and this is more of a local comment, New Jersey hospitals are eligible to receive an increase in their wage indexes, and this is due to a reinstatement of a rule, the imputed floor index rule. And once that rule now comes back into effect, New Jersey is one of about 4 states that are going to see their wage index get increased. In closing, I mean, we see mostly good news here for hospitals in this proposed rule. First, of course, is the rate increase that we discussed. The reduction in the price transparency requirements to save staff hours, add-on payments for servicing COVID patients continuing during the public health emergency, the rescinding of the value-based purchasing programs, so the neutral payments will go out to all hospitals. No hospitals will be penalized as a result of that program during the public health emergency. And lastly, the Medicare-funded graduate Medicare medical education residency slots starting in 2023 with 200 per year. I think overall, and the feedback from our research from the American Hospital Administration Association, rather in particular, the AHA was very pleased, using some wording from some of the executives there, with the initial proposed rule, and really felt that this was going to help hospitals across the country transition from the public health emergency, hopefully into a situation where they can get their volumes back up and business more back to normal. Thank you very much for joining us for this week's Healthcare Current Event Update. We hope to see all of you soon again. Take care.